Okay, cool. So now we're going to talk a bit about strategy now. So a lot of you guys are preparing for exams at various stages. Obviously, exams are a big part of, GP training and the stuff that you have to think about and deal with. So let's look at a quick idea first in terms of exams. What are you guys preparing for? Let me get a bit of an idea. Just please put in the comments of the chat. Are you preparing for AKT? Are you preparing for RCA? Are you preparing for MRCGPAKT? What is the stage that you are in terms of your current preparation? Just so I get a bit of an idea of where to focus most maximally on in this talk, if that makes sense. Okay, great. So we're getting a lot of AKTs, quite a few MRCGPs, and now some RCAs are starting to come in as well. So again, like we thought, because the breakdown of the people on this conference are ST1s, 2s, 3s, and people before GP training, we've got every exam mentioned here. But yeah, AKT and RCA feature quite a lot, and some MRCGPA as well. So this is all about AKT and RCA, but if you're doing MRCGPA, then the AKT section is going to help in a big way as well, because there's a lot of similarities in some of the types of questions that you get. So we'll briefly try and talk about some strategy. So this session, let's get my timer out so I don't go ridiculously over time, because for those of you who've been on our webinars, you know that I like to talk about a lot of things in a lot of detail. So we're going to talk about what is AKT briefly and how to think about preparation, what is RCA and how to think about preparation, what are the upcoming changes that you may have heard about, and what are the common mistakes that I see people do all the time when it comes to these exams, and how can you avoid them. But there's a question there about upgrading the package. If you can just answer that one through, or I can answer it actually a little bit later on. Okay, so for those of you who don't know me, if you're new to us, then thank you first for coming once again to this conference. I have a 24/7, 365 passion for medical education, particularly in GP training exams and GP training assessments. I used to be a TPD in the West Midlands. I used to write questions to MRCGPA. I used to be an advanced AKT trainer in the West Midlands deanery. So I had lots of experience of these exams and seeing the kind of things that people do or not do at times that can then lead to results that don't show their potential. You know, when people don't pass AKT or don't pass RCA, it's not often because you're not good enough, or you don't know what you're doing, or you haven't done the work. A lot of strategy and technique comes into this kind of thing, and that's what we're going to focus a lot on today. So we'll start with the AKT bit first and then move on to RCA. So with AKT, you guys know there are 3 sittings per year: January, April, and October. And I know a lot of you guys are preparing for the January exam, which is coming up fairly soon, but still quite a while away. 200 questions in AKT, 80% are going to be based on clinical, 10% are going to be based on stats, and 10% are going to be based on admin. It's a 3-hour, 10-minute exam for most people. Some people get a little bit extra time for various situations, but generally 57 seconds per question, which is not a lot. Applied is the key thing here. So it's not how much you know in AKT. They kind of assume now that you're a GP trainee, you've got into training, you've done a lot of exams before you, you've done a lot of medicine before you, you know a lot. It kind of assumes that you know a lot. Now it's all about, okay, how can you make quick decisions that we are trying to replicate for you in terms of a GP setting? So you're sitting in a GP surgery, you've got to make a quick decision. Is it this or this? I've knocked 3 out the way. Is it this or this? How do you make that judgment call? And sometimes more knowledge doesn't help you in that bit. Sometimes technique bridges the gap. So things like strategy and technique are so important, and they can build a gap between, okay, I know my knowledge is getting 3 knocked out, but with the final 2, is it A or B? Knowledge is not going to help you there. That's where a lot of gut feeling takes over. That's where technique takes over, and that's where we spend a lot of time in terms of training. The AKT pass mark, anybody know? Put in the comments if you know roughly what the AKT pass mark is. It's, yeah, we're getting a few people saying 71, 69, 70s. Yeah, so it's generally around high 60s, early 70s. It varies from attempt to attempt because a lot of stats goes around into each exam, and so it's not the same pass mark for every single exam. It's based on a lot of different things in terms of performance and stats. But the key thing, the reason we put this up is where your aim is. So when it comes to, a lot of people aim for the pass mark in AKT. So what we're saying, well, if the pass mark is 70%, I'm just aiming for like 72 or 73. And obviously you want that in the end. You're happy to just get above the pass mark. But when you start your AKT preparation, the first thing you've got to be doing is thinking, look, I'm aiming up top. I'm aiming for 100, because every question obviously has a right or wrong answer. Every question is gettable. And if you're subconsciously thinking, well, I'm only aiming for 75, then when you get those questions where you have to put that little bit of extra effort in terms of working things out, where things don't come naturally to you in terms of an answer, where technique has to come into point, if you've subconsciously dropped the bar and said, look, I'm just happy with 75, I just want to get a pass, then you're probably not going to push yourself in those questions that can make a difference. So we talk about aiming for 100%, not because you're going to get 100%, or anyway close it, but it means that you push yourself for every single mark, because knowledge gets you so far, technique can get you a little bit further to the right answer. But if you're not pushing to get every single mark right, then you're not going to push yourself to look for those small technique changes. So that aim, that mindset start is really important when it comes to AKT. Now, let's do a quick example. I'm not worried about whether you get it right or wrong, but just look at this question and you'll see several things where technique can play a difference. So this is a question about atrial fibrillation. You know, you guys, when by the time you come around to AKT, you've done AF, you've done questions on AF, you've read about AF, you know the latest guidelines, for example, and you'll get questions right or wrong because of knowledge, of course, but where can technique play a difference? There's a couple of things here that stand out straight away. Number one, you've got this double word here. Which of the following statements is least correct? Whenever you see a double word, we talk about changing that to a single word because it's much easier for your brain to look for the false statement rather than look for the least correct statement. Imagine going down all these statements. Is this least correct? Is this least correct? Is this least correct? Is this least correct? It gets really, really confusing, particularly if there are also negatives in the statements as well. So one of the first things we talk about is when you see a double word, change it to a single word. Give your brain something less stressful to deal with. So most appropriate, least appropriate, most accurate, most common. These double words in questions, condense them to a single word. It just gives you a better framework to go through. The other thing about this is the word least is so easily missed, because what your brain does is look for the big words. You look and you'll see AF very quickly. You'll see nice guidelines very quickly, and you'll jump down to start looking for buzzwords. Is it 48 or 46 hours? Is it DOACs at our first line? So your brain picks up on big words very quickly, but that means you often miss the small words, like the word least, and the small words are bigger than the big words in questions because they completely change what you're looking for or how you're looking at it. So just get, in previous exams, you almost are word matching. You're looking at AF, you're looking for key things. Now it kind of assumes that you have the knowledge. You're not word matching anymore. It's looking at the small words. So things like least and can and may and don't and do and more and less. They change the whole question, and often we don't see that kind of thing. So two things straight away in the question from a technique point of view that can help. Then you get other things, like you get soft words here. Can you see this? D, Rapamil can be a first line option. Now that's an example of a soft word, and hopefully when you start doing more and more preparation, then you'll start to subconsciously pick up soft words and hard words. Soft words like can and may, these are important for your brain to pick up, because anything that's a soft word means that you only need to do that 1 in a million times for it to be a true statement. And these are opposite to hard words, things like never or always, 100% of words. When you start to see those, again, subconsciously you pick them up and realize that, okay, it's very rare for something to be 100% in medicine, and therefore the moment you see those hard words, you start to kind of think that's unlikely to be a true statement. Again, that's all technique, looking at soft and hard and making sure that your brain picks those things up just as much as you pick up the guideline bits that you're really reading for in a question. Making sure that every single point in a statement is correct or not correct before you put it as an answer. Sometimes people read kind of 90% of a statement and think that that's true, so they almost make the last part or the last 1 or 2 words true. They almost don't see the fact that the last part of that statement actually changes it to a false statement, because you read it and 80% of the way you're deciding it's true, but you missed the last bit. So making sure that every single point is true or false. These things make a big difference. The answer here, by the way, for those who are saying, commenting it, is E. A Hasbled score should be used to assess bleeding risk before antiplatelet. That's wrong now, of course. That was previous guidance. So we talked about guidelines when we talked about Dr. Jade's talk earlier in the morning. Guidelines change very quickly. Hasbled changed to Orbit score probably about a year ago now. So it's not such a recent change, but it's a good example where for years you'll have read about atrial fibrillation and Hasbled. You'll be thinking atrial fibrillation, CHA2DS2-VASc versus Hasbled. That's just kind of ingrained into your brain. So even though you may have read recently that Orbit has now become the main one to look for bleeding risk, and it's not Hasbled anymore, sometimes your brain just goes into previous mode and it just picks up that link. Yes, Hasbled, atrial fibrillation, yes, of course it is. You don't actually think about it and realize that actually that's changed because it's so ingrained into your brain. So it's so easy to get marks dropped in AKT and MSRA if you're doing the clinical paper there as well, because sometimes you look for big words, you miss the small words, you don't change double words to single, you don't make sure every single word in a statement actually is true or false, you don't think about soft and hard words, and you go back to historical brain maps that tell you things that you don't realize in the heat of the moment. So that's just a quick example, and then you've got the detail, of course. So 48 hours would be the key here to think about cardioversion. That's why that's not the right answer in this statement. So you've got lots of key things that you have to pick up from knowledge and technique. Another example here is DOACs. We all think about in the past, it used to be anticoagulation. You either use warfarin or you use DOACs. This is now saying that DOACs are first line, which is true. And that changed probably again around about 9 months, 12 months ago. So it's just about making sure when you prepare for AKT, yes, look at guidelines, but make sure you're up to date. But don't just think that learning guidelines or doing loads of questions on guidelines is going to get you the right answer. Technique plays a big part. And it's those kind of things that we talked about, converting the double words, making sure that your brain does not miss the small words because the small words are more powerful than the big ones, making sure you almost start to subconsciously pick up the soft words as the hard words just to get you into a framework of thinking that's more likely to be right. So say you get down to 2 statements and knowledge can't work out the difference. These kind of things can help work out the difference. Are there any soft or hard words? Have I converted double words? Have I made sure every single word of that statement fits? And this can be the differentiator between you getting that 70% and that 75% that takes you just below the mark or just above the mark. So technique is huge. For those of you who've done any of our courses or mocks or whatever, or been on any of our webinars for AKT, we hammer this home in a big, big way because I see time and time again how much it can make a difference. So that's a really important thing to bear in mind. What about AKT approach, and what are the kind of things to think about before you start preparing, or to pick up now if you started to prepare for January? And a lot of you guys already have. One of the things we talk about when it comes to AKT is a dual-based approach. Lots and lots of people just go and do thousands and thousands of questions, and obviously you have to do lots of questions because you have to get your brain problem solving regularly and get used to doing that type of stuff. But that's a one-way single approach, just doing lots of questions. We talk about the second part of a dual-based approach, which is where you need to spend a bit of time, bit of energy, bit of effort building up your knowledge, filling in gaps that question banks can't cover. Because remember, the AKT exam can be taken, or there's the RCGP curriculum, a question can come from anything in that curriculum. And if you rely on purely a single-based approach, i.e. just doing thousands of questions, you're going to have gaps in your knowledge because you're just learning the things that are written at the bottom of questions. So you've got to find a way somehow to balance that with building up knowledge, whether it's reading through 9 CKS guidelines, whether it's getting a resource that does it for you, just finding a way to not just rely on a single based approach. That's really important, and we'll talk about how to do that shortly. Start with a plan. This is so important. People often just jump into preparation. Let's just get a question bank and just plod along and do questions here or there and expect it all to kind of fit at the end and come into place. No, that will leave you stressed with about 2 weeks to go, because you'll realize that I've just missed out so much stuff. I didn't even think about this. Where did this bit come from? And it causes you stress. Start with a plan. Guys, just put a yes in the comment if you have got one of our planners, our daily free planners. We had a link on in the chat. I think Dr. Wisdom will always put a link in again. Are you using those daily planners? Because that is a plan that you can start with. They're just things that give you a day-by-day program. This is what you should do in day 1, day 2, day 3, day 4. We do 30-day planners, 60-day planners, 90-day planners, 120-day planners, 270-day planners, depending on when you're starting preparation. Grab one of these free planners because they make a difference in terms of the stress level. You can kind of say, well, you know what, I don't need to worry now about how much I've got to do. I've just got to stick to this. And if I stick to this, I'll cover everything with enough time for me to go and nail this exam. So if you don't have a plan for AKT, you are going to get overwhelmed because there is just so much that you need to cover, so much that possibly can cover. There's a link just gone out now if you click in the chat. It makes a big difference. So, but you don't have to use our planners, of course. You can just make your own plan, but start with a plan. Thirdly, start where you don't want to. Often we look at a list of topics and we think, oh, cardiology, respiratory, women's health, stats, genetics, whatever. And we'll tend to say, okay, I don't really like women's health, or I don't really like genetics, so I'll just kind of leave that later. I'll do something I like, cardiology, whatever. And then you do all these things that you like that you actually find pretty easy anyway. And on your shoulder is always this thing that, oh, I still need to do women's health, and I still got to do genetics. And it's still there, it's still bugging me. Like, yes, I've done all this stuff, I still got to do this, and I don't like it, and I don't want to do it. Start where you don't want to go. Once you've made your plan, once you know where you want to go, think about what is the topic or subject that I hate the most? What is the topic that subject I've never really found easy? What is the topic or subject I've never really understood? What is the one thing that I just don't want to do? And start there. Push yourself to start there, because the confidence that you'll gain, the good feeling that you'll get when you finish that topic is immense, and it will just drive you to keep on going. Whereas if you've got this big thing on your shoulder that I've still got to do this, and I don't want to do it, and I hate it, but I have to do it, A, you might actually leave it too late and then get super stressed because you haven't done it, or B, you just, everything else gets affected because that's just in the way. So try and start where you don't want to go. Find your learning style. When we teach for AKT, we do lots of different learning styles. I can't say this is how you should learn for AKT. I can't say you should go and do all this reading or you should go and watch these videos, because some people learn through audio, some people learn through video, some people learn through reading, some people learn through doing bits and bobs in 10-minute blocks, some people learn by doing 4 hours in a row. Now you've just got to find your learning style. You're in a group of many people who are doing AKT. I'm sure you're on various WhatsApp groups and Facebook groups all about AKT, and people are pinging off their ideas about you should do this, that, or the other. Find your own learning style. Be comfortable and confident to go against the grain. If you learn by purely watching videos and you hate reading guidelines, then stick to that. If you learn by audio and just want to kind of do other things while you're learning, go with that. If you learn by just doing questions and filling in gaps of knowledge, then do that. But find your own learning style. Don't copy others. There's no right or wrong way. And one of the reasons we do so many different types of resource is that you can find what works for you, rather than us telling you this is what you need to do and use for AKT, which is different for different people. Make use of passive learning. This is really important, because you are going to have times where you dedicate to sitting down and doing AKT revision. That's just natural. I've got 2 hours this evening, 1 hour this evening. That's my AKT revision time. That's fine, and you need to do that. But it doesn't mean for the rest of the day that you shouldn't be picking up and locking in bits of information that are going to help you. You can't kind of be, well, I'm doing this right now, but this is my AKT time. This is my only AKT time. And one of the ways we do a lot of passive learning and trying to teach passively through social media, and we'll give our details away in a short while, but things like our Instagram feed, things like watching a 30-second YouTube video, things like stopping something as you're scrolling on Facebook and reading something that's of learning value. Passive learning is so important, and you can double or triple your learning in a day by making sure you use the benefit of passive learning. So if you're not on Instagram, for example, you haven't found us already on Instagram, then have a look at our Instagram feed. We do lots and lots of passive learning. No one goes to Instagram to learn for AKT, but you go to Instagram probably 10 times a day. So if every time you go onto Instagram, you see one color card that tells you one guideline, it's all adding up to your bank of knowledge. So make sure you utilize passive learning. Don't let this go. The other thing of passive learning that we do is our weekly free email teaching. It's just passive learning. It's just completely free, but you click it, you get 5 quick videos. It just helps you to build that confidence going forward, rather than thinking, I've got my block of learning today and that's when I'm going to learn. Things don't really work like that. And also passive learning at work as well. Obviously, when you pick up something at work, you see a patient and you don't quite know something, put it on a list to go and look up later on, or just look it up there and then. Just get out your phone and Google something. You'll find something of value, but don't miss the opportunities that you have for passive learning, because for AKT, you can reduce the amount of pressure that you put on the times where you actually sit down. I get asked a lot about best question bank. What's the best question bank? There are obviously 2 or 3 common ones that people genuinely regularly use when it comes to AKT. There is no best or worst question bank. One question bank someone will find very useful, another person will not find it useful. The opposite question bank, the other person finds it horrible, one person finds it absolutely brilliant. You will relate to a style of question better in one framework versus another. We have mocks, for example, because we know there are lots of question banks out there that people use, and we don't have our own question bank, but we do mocks because we know the pressurized situation is really important to do. But don't just think what's the best one. Just find one that works for you. And secondly, don't rely on one source of questions, because if you just rely on one source of questions, your brain is very used to one style of question, and you almost start to learn how to answer questions because of the way they write questions, and then you get to an exam and it's a different set of writers and it just stresses you because it's all new. So have at least a second source of question. There are lots of free question banks out there, free samples out there. We have free samples on our website. Just don't get stuck to one key source, whichever that source might be. Guidelines we talked about earlier with Dr. Jade, and a couple of key points came out of that talk. Number one, guidelines change very quickly and no one really tells you when it happens. So you've got to kind of regularly go to at least the core chronic diseases that you need to know that are on CKS, like asthma, COPD, hypertension, angina, and maybe once a month or so, just look at those. And now Dr. Jade showed you how to go into CKS and look to see, is there any updates? You don't have to actually read through the whole guideline to check for small words that might have changed. Look for what they tell you. When was it last updated? If it says March 22 and you've already revised it in July, it's fine. Like you can kind of gauge it. But if it says, oh, so we're in November now. If you look at the guideline for, say, I don't know, hypertension, and it says latest update October 22, it'll tell you what the latest updates are. So yes, number one, make sure you learn your guidelines, and we cover them all in our courses because I know it's hard to go through it all online. But if you do go online, make sure you look for updates, because there's no point learning something that changed 3 months ago or 4 months ago that's going to come up differently in the exam. And make sure you look at peer support, because AKT can be a lonely time when you're preparing, you know, especially if your study group or the people that are preparing are not your closest friends, and you don't really have, you talk to people about things but not AKT. Find an AKT group, bounce off each other, teach each other little bits, give each other little tasks like this week we're all going to do MSK, for example. Like, just have someone or a group of people that are in the boat with you. Otherwise, we know how busy work days are. You get home and suddenly you're on your own. You have to give the motivation, build the motivation to do work. It is hard. It is tough when you're tired, coming off nights, etc. But if you have that peer support there, then it just gives you that little bit of an edge. You become accountable to somebody. Okay, they're all revising MSK, so I need to revise MSK as well. Or I've got to explain hemolytic anemias tomorrow, so I need to get it done. Like, that kind of thing can really help. So sometimes that pull factor, you can push yourself to a certain point, but you need a bit of pull factor as well. And that's where peer support can really, really help. And when you add these kind of 8 things together and you think about strategizing your approach and not just going all in, gung ho, and just thinking, well, it'll figure its way out, then this kind of mentality comes in. We always talk about hashtag can't pass, will pass, getting the mindset right that, you know, yes, I can pass this exam, but it's all very well and good just saying I can pass this exam, but unless you have strategies and approaches towards it, then you may find it stressful, and you may find it not as easy as, say, somebody else who's got things organized in place. So hopefully you can use some of those things. You can look at the planners, if you like, just to see if they're going to offer some value to you. The kind of things that we do when it comes to AKT, our most comprehensive package. We've had a few questions coming in about Gold Package already. The AKT Gold Pass package is designed to give you multiple resource types to try and hit both knowledge and technique, so that all combines by the end. So it contains 3 full online courses, video-based courses, chapter courses you can watch multiple times. It contains both digital flashcards that are for AKT, so the blue guideline cards and the green farmer cards. 3 audiobook courses that allow you to listen when you're commuting, traveling, shopping, at the gym, etc. So they buy you time more than anything else. Difficult mock exams, a whole bundle of mock exams to put you under that time pressure, to make you learn through that, alongside question banks. You've got to do your mocks as well, and then the live course that you can attend before the date that you choose. So the Gold Package is a 12-month program, so whether you're doing the exam next month or in 12 months, you can utilize all of these things. And if you use them alongside the planners, it'll tell you what to do on each day, which chapter to watch, which card to read, which audio chapter to listen to, etc. So a lot of you have already got this, which is great. If you don't, remember the coupon today will get you 15% off Conf Save. And we've had a few questions about upgrades. Someone said, for example, I've already got the audiobooks. If I upgrade to the gold, can I still use the coupon? Yes, yes, yes. So use the coupon today, buy the whole package. We will refund you back the amount that you paid for the audiobooks, for example, or for the mocks that you bought in the past, for example. So yes, you can upgrade today. But just a few words on what we do when it comes to AKT. And don't forget, like on social media, we do a lot of AKT teaching. Instagram, Dr._Aman_Aurora. Please do have a look at that. YouTube is the other big one that we target now. Instagram and YouTube are where we do our majority of our teaching. We still, of course, teach on Facebook. That's a big area for us, but these two are huge in terms of passive learning, and then Twitter as well. And a lot of you guys have been tagging us on these streams today, which has been great, part of the conference. But please do have a look at it and make use of those passive resources out there. If you are doing AKT in January, then you need to register for the AKT 8-week booster webinar. That is on the 29th of November. I think, again, my wife, Dr. Pooja, will be putting a link for the webinars in the chat. Please, please, please don't miss these. We do an 8-week webinar, and we do a 4-week webinar. And like we mentioned in Dr. Vanessa's session, we'll be doing a stats webinar between those two as well. So really make sure you get advantage of those webinars, because why not? They're passive learning, and they're things that you can hopefully get some benefit from. Right. I will have a look. There's a question coming about extending packages. So if you're, say you get the package today and you're not doing AKT for another 15 months, we're not going to just cut it at 12 months. We do allow extensions. We'll just extend it for a little bit longer. That's not a problem. We'd rather you get onto the material early so that you feel you're on track, rather than just waiting for that 12 months to go and then signing up to it. And someone else said, I got my exam in January. Is the gold package still useful? Yes, definitely. People get the gold package with a month to go. There's plenty of time. We just give you the material for 12 months, but you can utilize that material as and when you like. So for January exam, of course, there's plenty of time to get that done. Right, so let's look at RCA basics then very quickly. So RCA, of course, there's been lots of changes with RCA. There are changes to come with RCA. It used to be the CSA exam where you go to the RCGP building and you do 13 consultations with the role plays and you're marked. Then, of course, COVID came along and RCA took over in terms of the temporary replacement, where you then do 13 recorded submissions. So you record them from work, so recording your video consults, audio consults, or face-to-face consults, and then you submit them, and then the examiners will watch those recordings and mark you in the same way that they used to mark you really for CSA, the same 3 domains we'll talk about in a second. So current RCA dates, November 22 is the one that's imminent, and you're submitting your videos by 16th of November. So some of you guys may be doing that already. Upcoming ones are January, March, and April next year. There is, of course, the new exam that is going to be coming, and they do say it's going to be mid-23. We had a little bit of information come out last week, and it seems to have kind of gone a little bit now, so we couldn't really find it. I think they might have taken it off the website, maybe because of lots of questions coming up, but there is a new exam coming. But for now, it is still RCA, and at least until April 23 is going to be RCA submission. So there are certain mandatory cases amongst the 13 that you need to record, but the main thing is you're being marked on 3 different domains: data gathering, clinical management, and interpersonal. And I'll talk about how you can use strategy to boost your marks in these 3 things in a second, but it's important to understand a bit about what RCA is. We have blogs on what is AKT, what is RCA, etc. So okay, maybe my wife, Dr. Pooja, can put links in the chat for those blogs that you can save and you can read about a little bit later, going into more detail. But RCA, just like AKT, is all about mindset. Very different mindset to AKT. AKT is where you sit down, you learn things, you pass an exam. RCA is a continuous flow of how do I keeping myself motivated to record and do my best consultations? How do I get those 12 minutes that you are recorded on for each case? How do I make them work as best as I can? It's a totally different mindset. The mindset we always talk about with RCA is an issue-based approach. It's not about, okay, do a history, what's the diagnosis, and then manage that as per guidelines. That's part of what you're trying to do, but really it's an issue-based approach that you're thinking about. So for example, what are the issues in this situation that I need to understand as a GP, and then how do I demonstrate I know how to manage those issues and take that story forward in the second half? It's all about issues: medical issues, non-medical issues, ethical issues, mind issues, life issues. Think of it about as how many issues can I understand, and then how many issues can I demonstrate I can take forward. It's an issue-based approach in terms of your consultation. It's not about what's the diagnosis, what's the treatment. Yeah. Situation management, very important. When you come to the second half, for example, your mindset has to be right. You have to be thinking that I am managing a situation, I'm not managing a problem, I'm not managing a condition. So for example, if you do a hypertension case and you just manage hypertension, you may not score as well as you think you should. But if you manage a situation which includes the hypertension bit, which includes the worry about getting an MI, which includes the fact that you're talking about lifestyle changes, which includes the fact that you're discussing how, you know, risk factors or complications of MI, that is all the situation that you're managing. You're managing the mind, you're managing the life, you're managing the medicine. If you think about that mindset, that I'm not managing hypertension, I'm managing the situation in front of me, automatically you look at a bigger picture at the beginning, which will allow you to talk about more things and demonstrate a more holistic, patient-centered management plan. Remember, you can't achieve everything in 12 minutes. People often say, oh, I didn't quite finish it in 12 minutes, that's not going to be worth submitting. No, you have 12 minutes to demonstrate certain core skills. It's not that you have 12 minutes to finish a case. You've just got to make sure by that 12-minute buzzer or bell, no bell, but they just stop watching at 12 minutes. By that point, you need to have demonstrated certain skills, and we'll talk about those in a second. And remember, this is a real life situation. You have to expect the unexpected. Just because a case is going perfectly well for 9.5 minutes, and then something happens that kind of wasn't expected, that you think, oh, that wasn't very good, doesn't mean it's a bad case. You have to expect the unexpected, and sometimes showing how you deal with something that's unexpected is actually a really good skill to demonstrate. So don't aim for perfection. If you aim for perfection, you'll never submit anything. Just aim for things that look reasonably good, where you've demonstrated certain core skills, and just expect that once in a while things are going to come up in the middle of 12 minutes that you're not expecting, that weren't really according to plan. That's fine. Different to CSA exam. In the CSA exam, you can almost hope that everything was perfect because it's a role play based situation. This is live medicine. You're doing a job at the same time, so you have to expect the unexpected, and it doesn't have to be perfect. Very important. So once you get your mindset right, you're in a good position to start thinking about how do I score marks then. So for those of you who know a bit about our teaching for RCA, we talk about three bubbles. We always talk about three bubbles in data gathering. Data gathering is thinking about what issues do I need to know that I can take forward into the second half. And generally, three bubbles will give you these issues. If you're doing RCA, sign up to the RCA webinar that's coming up in December, because we're going to cover all this in much more detail. Red flags, psychosocial, ICE. Red flags, issues that a doctor can't afford to miss. Medical and non-medical. Psychosocial, how is medicine impacting life, or how is life impacting medicine? And then ICE, what are the issues going on in the patient's mind? Once you, to be honest, once you collect these three things, if these bubbles are all filled properly, you have understood everything that you need to understand as a clinician. Yes, in there, you're going to be doing a general history at some point. If someone comes in with low back pain for the first time, someone comes in with a cough for the first time, of course, you're going to do all of this. We talk about other things, 3 C's of chronic disease. Any chronic disease, think about number 1, compliance. Think about number 2, checking understanding of the condition. Number 3, consider depression. These are all things that we talk about in our courses and things in more detail. Yes, you're going to do these kind of things. Go back in time. Someone comes in with a 5th presentation of knee pain, you're going to have to go back in time and go through the story. And at some point, of course, as part of data gathering, you will examine, but always focus on these 3 bubbles. My job is to understand 3 bubbles in the first half. When you simplify it, it means that you can demonstrate more skill and understand more issues. Interpersonal is all about how patient-centered are you throughout those 12 minutes. And we talk about 3 Aurora R's. We've got the reasoning, so signposting for red flags, for example. Relevance, making sure that every single question you ask, you're demonstrating relevance to assessor and to patient. And reflection, anytime you get information, reflect it back. Show that I genuinely wanted to know that, rather than, okay, I've got that, thank you, what's the next question? These 3 R's really help boost your interpersonal when it comes to RCA. And again, we talk about these in much more detail on the free webinar, but also in the online course as well. Interpersonal talks about how you deal with cues, verbal and non-verbal. It looks at how you deal with emotion, the patient being angry, patient being embarrassed, patient being blasé, patient being pushy. How do you deal with these, and can you demonstrate skills to deal with those in a holistic way, making sure there's a 2-way conversation when an assessor is watching or listening to an RCA case. If they're just hearing one voice the whole time, then it's not going to sound very good. So 2-way conversation using things like chuck and check technique, again, that we talk about in the course in detail, and generally making sure the consultation is going to be flowing from start to finish. Often there's a flowy first half, and then there's a very doctor-centered second half, and it's about making sure that the whole thing is patient-centered. But using these 3 Aurora R's can really help. And in terms of management, very quickly, it's about setting the base. It's not about, okay, I've got 15 things that I've understood, I've got to manage 15 things. It's about having that strategy in mind. We talk about 3 steps, really: diagnosis differential, which everybody does; offer explanation, which everybody does. But the third thing that we talk a lot about is issues on the table, the golden first minute of management, thinking big before small, showing the extent of the situation before you narrow in. That kind of technique, that strategy, that mindset is so important to allow you in a 3-minute management plan to score big, rather than, okay, great, I've got 5 minutes to do this, but you still don't score very well because your strategy is not right. And again, we talk about a lot more about this on the webinar, so sign up to that if you haven't already. And then, like we said, don't try and complete management. Your aim is not to complete everything by 12 minutes. Your aim in management is to get a strong base, demonstrate awareness of a situation, and probably manage 1 or 2 of them before that end of the 12 minutes. If you understand early on what your task is or what your aim is, it makes it for a much less stressful consultation. So whether it's AKT or RCA, knowing about strategy is really important. From an RCA point of view, the package that's our most comprehensive one is our RCA Gold package, which contains a full video online course, 2 different audiobook courses, and 2 different sets of flashcards, 1 for data gathering, 1 for explanation. And those are all geared toward an online case bank. Those are all geared towards RCA, whereas the AKT Gold package is all geared toward knowledge and technique from an AKT point of view. But again, if you're looking to get any of those today, then make sure you use that coupon CON15. I know a lot of you guys have already done that today, which is great, but hopefully that will help you in your preparation. And again, similarly for AKT, lots of passive updating and learning through social media. Again, Instagram and YouTube are going to be the 2 go-tos, the ones that I will always suggest go to first, because we cover a lot of free passive stuff for both AKT and for RCA. Our next RCA booster webinar, if you're taking RCA anytime in 2023, you're looking at 13th of December. Again, there should be a link in the chat for where you can register for this now. So it's done and dusted. You get reminders near the time, but at least you've signed up and it is ready to go. So take our messages, because I know we're running slightly behind time, and we've got an excellent speaker coming up very shortly. AKT and RCA guys are very passable. If you're at the beginning of your GP training and these are a bit of a mystery to you right now, and you've heard all these rumors about how people struggle all the time with these exams. Yes, people do struggle, but they're also very passable. But you can't just rely on luck to pass your exams. You have to strategize, you have to plan, you have to be aware of what's out there to help you, and you want to go with a bit more of an efficient mindset rather than let's just kind of plod along and hope it all works out because it seems to work out for most people. No, you don't want to put that stress on your head. Technique is important, whether it's AKT technique that we talk a lot about in terms of how you approach a question, the small words, the hard words, the double word changing, that kind of stuff, or is it RCA technique where you're thinking about what is my job in 12 minutes, three Aurora bubbles of data gathering, 3 Aurora R's of interpersonal, 3 Aurora steps of management. Strategy, technique are important. If you want to push yourself into that comfort zone of, okay, even if I make a mistake somewhere, it doesn't really affect me, you need to be pushing things like strategy. You don't want to be on that kind of borderline where one mistake puts you below, and these things are very important. MSRA, a few words about MSRA. If you are doing MSRA, then we have lots of teaching for that as well. Haven't talked about it in this because this is purely for GP trainees, but we have MSRA webinars coming up as well that may be of some value to you. There's one coming up, I think, in a couple of weeks' time. Great, I rushed through all of that stuff because you can't really cover AKT and RCA, to be honest, in 40 minutes, but I've tried to show you how, you have to have a little bit of thinking about these things. And if you do, they are very passable exams. And also start preparing early. Don't think that, you know what, AKT comes up later in my life, RCA comes up later in my life, I'm just not thinking about it right now. Passive learning is very important. Keep these little nuggets going into your brain regularly so that when you do start full on prep, you're already a little bit ahead of the curve. And the reason we do our goal packages and we start them with, we give you 12 months access is because we want you to start in advance. We don't want you to get to a week before your exam and suddenly think, oh, what should I have been doing for the last year? Get involved early, start using them early, dip in and out of things as you want. And then you'll feel when it comes down to that final kind of month where we all know that's where the majority of your prep happens, you feel ahead of the game and you don't feel so stressed. So I really hope this helps. There's lots and lots of questions coming in that I can go through. Have we got some time, Bridget, for Van starts a talk?
One of the questions that's come through is, what is the difference between mocks and question banks?
So yeah, so question banks are basically things that you generally sign up to and you can dip in and out. So you can say, I'll do 10 questions today, I'll do 100 questions tomorrow, I'll just dip in and out and do a few in the middle of work. That's good for kind of ongoing general problem-based learning. But mocks, obviously, we don't do question banks, we do mocks. We really focus heavily on mocks because people do a lot of question banks and they get to the exam and they haven't really done that 200 questions in 3 hours 10, and that's it's a big stress on your brain. So when you buy the gold package, you get a whole bunch of mock exams all preset so that you can sit down and do them in the required time frame that you get for AKT. So that's the main difference. You can of course form your own mocks from doing banked, but to have that ticking time bomb going down is why we think mocks are so important. And you can of course get the mocks separately as well. You don't have to get them in the gold package, but that's the main difference. Someone's asking about the planners. So the latest planner for AKT started, I think, a couple of weeks ago. There's another one coming out at the end of this week. And we tailor them. So whether you're doing the January exam or April exam or October exam, there'll be planners that will be starting within a few weeks for you, whether it's a 180-day planner or a 60-day planner or a 30-day planner. Just keep checking that page because we keep updating to the latest packages. What are the costs for the gold packages? So if you go onto the website, you'll see normally, I think for the AKT, everything in total, if you buy them separately, is around 1,200. When you break it down, the normal package is 747. With the coupon today, it goes down to around 6 something. So it's a big saving if you use the coupon today. RCA, I think, is about half of that.
Yeah, when someone's asking in terms of the MSRA planner, is it too late to start it?
No. The MSRA 60-day planner started last week. So you can just download the MSRA planner. It's literally 5 days you're behind. So if you do those 5 days, and do an extra day for the first 5 days, you'll catch up and you'll be back on track. There's also a 30-day planner that will start in 3 weeks if you really want to start from fresh. There's a question coming in about coupons. Catherine, just send us an email. We'll see what we can do for that. Send us an email. That's probably the best way to do it rather than trying to go through all the details here. How long can I extend the package? Yes, like I said, it's 12 months is the official package length, but we do obviously extend it if people need it because we'd rather get you going in early rather than going in late. And finally, there's a question again about Is it too late to get it if my exam's in January? Absolutely not. Most people will get the AKT Gold package within 1 to 2 months before their exam. That's why the majority of people will buy it anyway. It's just that we just give it to you for 12 months, but most people won't be getting it at 12 months to go. Most people get it in the last couple of months and then really hit it hard to get the most value. There are a few more questions, but I think I'll probably take them offline and just answer them individually. Pooja, what do you think? So we can get our next speaker in. What do you think?
Yeah, absolutely. And just to go further on the point that Amin mentioned in terms of the planners, as with all the exam planners, it doesn't really matter in terms of the date. A lot of them you can sort of catch up on. The idea is to give you some structure around your revision. But yeah, let's move on to the next speaker.